the African Union health watchdog declared a public health emergency over the growing Mpox outbreak on the continent, saying it is a clarion call for action. Hey, got to love the English. We declare Mpox as public health emergency of continental security. This is Jean Kaseya, head of the African Centers for Disease Control and Prevention. That is the African CDC. Okay. Now, why is this Mpox situation, giving or rather prompted the CDC to take action? More than 38,000 cases had been reported up to August. This is up to August in January 2022. 38,000 cases had been reported. And of those cases, 1,456 people had succumbed to Mpox. Now, Mpox, mind you, can be transmitted via touch. If you kiss somebody, if you hug somebody, if you share things with somebody who has Mpox, it's very, very possible, for you to get it. Mother to child can actually transmit Mpox. So the new strain that is getting people very scared is this one now that can be transmitted through sexual relations. Initially, it couldn't, but right now, it can be transmitted through sexual relations. So like I told you, those figures are so huge. 38,000 people, had been infected. More than 1,400 had succumbed to the disease. Now, where did this initially start? A lot of cases had been reported in the Democratic Republic of Congo and various parts of the world, and the CDC and the World Health Organization had come up with measures to try and contain it. So this is between July 2022 and May 2023, where there was a serious outbreak where more than 140 deaths were reported and more than 90,000 cases of infections were detected. I'm telling you, man, those numbers are quite shocking. And as a continent, we have to take measures to protect our people. And I loved what the doctor said. Right now, this is a situation that we have to contain because families have been broken. Jobs have been lost. People have lost their livelihoods to this particular Mpox disease, and it's important and high time that we declare it a state of emergency and we find a way to contain it and eradicate it fully from the continent. Now, it is interesting that as of last year, the United States had contributed more than 17 million into the program to assist the continent into fighting this particular disease. Very, very important to note that it is something that we cannot do it alone. We need help. And because, as we know, the nature of infections and diseases, it can spread beyond borders, as we've clearly seen it happening in Africa. Very, very important. Now you're in the know. That is our first health feature this particular morning.